was I? Oh, I know where I was. The Thut. Have you all heard of this? Unfortunately, the Thut occurs when you lose that nice definition between the buttocks and your upper thigh.
Now, Travis, I have to ask
like
you, you were
thigh
diagnosed earlier last year with that condition called nasatile. Remember?
Yeah.
So is that the same as Thut?
I think it kind of is. So, you know, I was diagnosed here on the stage with nasatile. So I thought to myself, I need to do some work. So what you all don't realize is when I host the show, this is actually a fake chair. I'm just doing body weight squats the whole show.
Oh, wow.
You know, you bring an interesting point, though, I think, with this, because I see a lot of this. I used to be a personal trainer, actually, before I was a surgeon. And that area is one of the most common areas people come in for. And the problem is, like he's saying, a loss of a gluteal fold, which isn't really a fat problem, it isn't a skin problem, it's a muscle problem.
So you can build up that gluteus muscle by doing body weight squats, lunges, getting out of your chair.
Exactly.
Every now and then, because we're in our chairs so often. Now, I don't sit that much. Why do I have a Thut?
Might be genetics. You know?
Honestly, I don't even know if I have a Thut because I don't really like
I need
stairs.
to assess that for myself.
I've seen you naked. You have a Thut. You don't have a Thut. You're good.
But Gary, are you putting what implants in?
Well, I think that's the second message here, is that doing body contouring in that area can actually make the problem worse. People do not want to do liposuction in that area because the connections to that fold, you can break them by doing the liposuction in there and actually flatten the butt more. So I try to tell people, don't do surgery there.
So I love that because here you are, a plastic surgeon who, quite frankly, makes your living doing surgery, doing procedures. And it's cool to hear you also, as a personal trainer in the past, saying, look, this is just something, if you want to look better in this area at home, exercise, anything that engages that buttocks muscle, which is a massive muscle, by the way, when we work it out, it will tend to grow in a good way to give you the definition you're looking for.
So should women obsess about the Thut? Is this something that we can actually increase the Thut through exercise, or is it the butt implants? That's what everybody's doing.
I don't think the butt implants necessary. There is a Brazilian butt lift where you can do some fat grafting to lift and shape the butt up high, but really in that area, absolutely right, exercise.
Wait, so I'm trying to get some clarification here. Do you have a Thut when you don't have the definition, or is it like
a Thut when you don't have it?
The Thut is a loss of definition, so it's basically a connection like a cankle, or somebody saying, I don't have any ankle, I don't have any.
That's the medical term.
You don't want to have a Thut.
That means you don't have the definition.
Yeah.